music took a hit during the pandemic, but I can tell you the good times are beginning to roll again. We are getting our sunshine back, and live music is roaring back as well. But the reason that's happening is because we do have 3 safe and effective vaccines. And they protect ourselves, they protect our communities, and they are our ticket back to full normalcy. I'm joined today by Dr. Joe Cantor with the Louisiana Department of Health, but also the Commissioner of Higher Education, Dr. Kim Hunter-Reid. And of course, it's always a great day for me when Donna, our First Lady, joins me for a big announcement. And I suspect that you all probably have an idea of what this press conference is about and what I'm going to announce in just a few moments. If you don't, I'll drop a big hint. Just look at the decorations. And I think now is the time I'm going to scoot over here, and we're going to unveil what's hiding behind these. I think they're actually tablecloths. So your name here just won $1 million. No. Obviously, we are announcing our Shot at a Million initiative, which is a new COVID vaccine reward program for the month of July. This is part of our larger Bring Back Louisiana campaign. The way this is going to work is 14 lucky Louisianans with at least 1 COVID shot will win cash prizes or scholarships throughout the month of July, culminating with a grand prize of $1 million. There will be 4 $100,000 prizes for adults 18 and up, 9 $100,000 scholarships for children between 12 and 17, and 1 shot at $1 million, again, for adults 18 and up. So all told, we're giving away $2.3 million in cash and scholarships for people who decide to go sleeves up against COVID. And there's a schedule that you're going to be able to access, but I did want to go over it in just a moment. For the first 4 weeks, it's going to work sort of on a Friday, Wednesday, Friday basis. So for example, the last day to enter, the first drawing will be on Friday, July the 9th. And you have to do that before midnight. And then on the drawing date will be the following Wednesday, July the 14th. And then the announcement of the winner will happen on Friday, July the 16th, 2 days later. And that's the schedule that we're going to keep. There'll be a slight change for that in the last drawing, because on August the 4th, we're also going to have that last drawing for $1 million. But you will actually have until July the 31st, which is a Saturday, in order to be registered for that drawing. And then the announcement will happen 9 days later on a Friday, but 9 days later on August the 13th. The key here is you have to be vaccinated, at least 1 shot, and you have to enter. That's not going to happen automatically for people just because they've had their shot. And I'm excited to tell you the registration for Shot at a Million will begin this Monday, June the 21st at noon. Vaccinated Louisianans can register online at shotatamillion.com. Shotatamillion.com. If you do not have access to the internet, or if you have questions, or you just prefer to call, you can actually register by calling a free hotline. The number is 1-877-356-1511. That too starts on Monday, 877-356-1511. You can go to the website now to learn more about how to get your shot at a million. But again, the registration starts on Monday at noon. It is, I think, important to note that the Shot at a Million hotline is different from our vaccine hotline, and I'm going to be giving you that information later. Shot at a Million is Louisiana's version of the lottery programs that you've seen in a few other states. Before launching our own program, we wanted to see how well it worked in other states, and quite frankly, we've been impressed by the success that they've had. In fact, media reports show that Ohio saw as much as a 49% increase in vaccinations among people 16 and older. And I, for one, like many of us, would love for Louisiana to see that kind of increase, because we want our people to be protected. We want decreasing positivity, decreasing cases, decreasing illnesses, decreasing hospitalizations, and certainly decreasing deaths. And this is the way that we accomplish that. It's the way that we can make sure that we return to normalcy and are able to safely gather, listen to music, and enjoy ourselves. And even though we use the term lottery, there is nothing to lose. There's only gain associated with Shot at a Million. Everyone starts out a winner, because in order to participate, you've got to get your shot. You'll be protected from COVID-19, and when you do that, if you register to win, you will have a shot at 14 life-changing cash or scholarship prizes. So this is a win-win for everyone, and it's also a win for our state. More than 1.7 million Louisianans have gotten at least one COVID-19 vaccine already. Obviously, we need more people to go sleeves up before we can truly end the pandemic and before we can truly bring back Louisiana. And I know that there are many people who intend to get the vaccine. They just haven't gotten around to it yet. So Shot at a Million is a reward for those who've already gotten vaccinated, and a fun nudge for others to get the vaccine sooner rather than later. And by the way, this is for anyone who has gotten their vaccine. So if you get your first shot tomorrow, you can register. But if you got your first shot on December the 12th of 2020, which was the very first day they were available in our state, you can register as well. The COVID-19 vaccines are safe, effective, and free. Hospitalizations and new cases are lower than they have been. You're going to get more information on this from Dr. Cantor in just a moment. However, COVID-19 variants continue to pop up and to spread, and they are very concerning, especially now, the emergence of the Delta variant. And it's important that we all do what we can to make sure that we don't see a surge among our unvaccinated residents. The COVID vaccines are very easy to find in Louisiana, and this is the COVID vaccine. Now, this is not where you register for your chance to win $1 million. But you call the vaccine hotline at 1-855-453-0774. Those lines are open 8 a.m. to 8 p.m. Monday through Saturday, and 12 p.m. to 8 p.m. on Sunday. People on the other end of the line there on that vaccine hotline, they can answer your questions related to vaccine. They can schedule an appointment. They can find a vaccine provider or community event near you, and they can connect you to a medical professional if you still have questions. So at this point, I'm going to ask Dr. Cantor to come up, and he's going to share some information with you. He will then be followed by Commissioner Reed, and then I will return with some comments about the weather and some other things that are going on before I take your questions. But if you would, Dr. Cantor, come on up.
Good afternoon. Thank you, Governor. Thank you for your leadership. And particular thanks for joining us, Ms. First Lady. It's so nice to have you here and help kick this off. To Commissioner Reed, thank you for joining as well. And to the Mahogany Brass Band, thank you for your fine work, gentlemen. It's always usually a great day when you get to see a brass band, so thank you for being here. We, as the Governor alluded to, we're not out of the woods yet with the pandemic, although things are much, much better. This is about 15 months in, and our sense of normalcy has really come back. July 4th is almost upon us, and we have a whole lot to be thankful for, with the cognition that we're not yet totally out of the woods. Every new individual that chooses to get vaccinated brings us one step closer to the clearing, one step closer to where we want to be. And that really is why we think this initiative, this Shot at a Million program is worth it, because it's going to create some excitement. It's going to get us a little bit closer to where we want to be. Take a step back, ask why are we doing this? Why are we doing a lottery? And I was thinking about this over the past week, and despite our numbers looking much better, and I'll go over those in a second, we continue every single day to unfortunately report individuals who have passed away from COVID. 7 new individuals today, 10 new individuals yesterday. In fact, we're averaging between 45 and 65 individuals who pass away from COVID every week, going back a couple months now. When lives are on the line, you want to try everything. That's the bottom line. And that's something that I know from working in the hospital as an ER physician is you never want to go home after caring for a sick patient and wonder what else you could have done to help that patient. When lives are on the line, you want to make sure you try everything. And now that we're in the home stretch here, we really want to make sure that everyone feels excited and encouraged to get vaccinated, and we think this program is really going to help that. And it's fun. This is exciting. We have a lot to be thankful for, and this is a good way to wrap that all together. I'll tell you, while cases are low right now in Louisiana, much lower than they have been in months past, this is our time to be working hard to ensure that they stay low, to double down on those gains, to increase vaccination, because we have no crystal ball. This pandemic has been humbling to all of us, and we don't know what the summer is going to bring. We don't know what the fall is going to bring, and we have some liability. And when the weather gets hot down here, it's the same thing that happens up north during the winter months, drives people indoors. We know that increases transmission. We know the variants are increasing, particularly the Delta variant. All of those give us concern. So let's do everything we can now, really over the next 4 weeks, to increase vaccination as much as possible, set ourselves up for as safe a normal summer and fall as possible. That's what this is all about. I can tell you, as of today, about 1.7 million individuals in Louisiana have gotten at least their first shot of the vaccine. Each and every one of those people will be eligible for the prizes that the governor mentioned, $2.3 million in cash money prizes and scholarship money. Everyone, each of those 1.7 million individuals who have at least initiated the vaccine series, that's 37% of the population of Louisiana. That's not insignificant, but we can do better, and we are going to do better. We have 335 new cases of COVID announced today. I'm happy to let you know that the percent positivity of all tests being done has dropped a little bit from 3.1 to 2.9% this week. That is encouraging. We now have 40 of our 64 parishes in the lower 2 categories for risk of community transmission. That is encouraging, and we've been below 300 hospitalized patients with COVID statewide for about a month now. That is encouraging as well. We've been below 5% positivity for about 4.5 months. So again, we're doing very well, just not fully out of the woods. I mentioned the variants, and this does give me quite a bit of concern, particularly now what's being referred to as the Delta variant or the B1617.2 variant, or what was formerly known as the India variant, because that's where it originated. We saw what happened in India a few weeks ago, and that was quite concerning. It looks to be happening in the UK right now, where about 90% of the cases are this particular variant. And in the US, where 9.9% of all COVID is this particular variant, it is spreading quickly. And the CDC estimates that that number is doubling every 2 weeks right now. In our region, which includes us in Oklahoma, Arkansas, Texas, and New Mexico, 12.7% of all COVID is this particular Delta variant. In Louisiana, we have identified 6 cases of the Delta variant through genomic sequencing, but we know we don't do as much sequencing in the country as we probably need to be. So when you have 6 cases identified, you almost certainly have many, many more that you just haven't identified. What do we know about this variant so far? We know it's more transmissible than just about every other variant that we've faced so far. It's more transmissible than the UK variant, which we were concerned about a month or 2 ago. We know it's more virulent, and both in India and the UK, it's sending more people to the hospital than the previous variants. And also, thankfully, like the previous variants, this Delta variant remains a good match for the vaccines we have. And we're fortunate for that. There's no assurance that that's going to be the way for future variants, but it is for this variant. I should say, one of the things that makes it so important to get the second dose of a 2-dose series, if you're getting Pfizer or Moderna, is that their protection against variants like this particularly increases. And let me illustrate that. People that had the Pfizer vaccine that just had only 1 dose and left it there had 33% protection against this Delta variant. When they had their second dose and completed this series, that protection went up to 90%. So ever more so than it's been before, because of these variants, it's so important to complete the series if you are getting Pfizer or Moderna, which are 2-dose series. The CDC earlier this week elevated this Delta variant to what they consider to be a variant of concern. And I think we're going to be keeping a very close eye on this over the summer months, hopefully keeping it at bay. And again, the best way to do that really is for more people to choose to get vaccinated. Easiest way to protect ourselves against this variant. I also wanted to mention one other thing we haven't talked too much about in these forums, and that's the idea of long-term symptoms after someone gets and initially recovers from COVID. There's a couple names, long haulers or long COVID, it's been called. The CDC issued some clinical guidelines this week and gave a formal name to this, and it's post-COVID conditions. This is an area that we're learning more and more about every day, but it is frightening, particularly because even individuals who had very mild or even asymptomatic courses of COVID when they had it are still getting some of these symptoms. Up to 80% of individuals who had COVID, whether they're symptomatic or not, are experiencing some of these symptoms. And we consider these symptoms to be qualifying if you get it up to a month or longer after you have presumably recovered from COVID. A study also came out this week that showed about 1/4 of individuals, 23% of individuals who had COVID, presumably recovered, then had these long COVID symptoms that were severe enough for them to have to go get medical care. 23% of individuals. These symptoms are broad. They can include shortness of breath and chest pain, anxiety, depression, headaches, hair loss, incontinence, sexual dysfunction. Nobody wants any of these, and that's one of the things that makes COVID scary is we're still understanding how this virus works. There's still a lot of unknowns about that. I mention this because the benefits of getting vaccinated are widespread, and it's not just protecting yourself against the worst complications, hospitalization or death, not just protecting your family by reducing your ability to spread the virus unknowingly to them, but also protecting you against these longer-term symptoms, which might not be fatal, but can be life-altering. So if people need to know that, and one of the more benefits to getting vaccinated. I'll tell you, we continue to track what we call breakthrough cases. These are individuals who got fully vaccinated, meaning they were 14 days out from their vaccine completion, and then yet still got COVID. It's very, very rare, but we do track them because we want to understand more. We've had 1,314 breakthrough cases in Louisiana of people who are fully vaccinated. When you do the math, that's 0.09% of everyone who's fully vaccinated in Louisiana. So very small population, but important for us to look at. Of those 1,300 individuals, 79 were hospitalized and 25 died, or 0.002% of everyone who's fully vaccinated. And again, these vaccines are extraordinarily effective, 94, 95%, but nothing is 100%. And that's one of the reasons why it's so important not just to get vaccinated yourself, but to talk to those around you and encourage other people in your life, whether it's a coworker, a friend, or a family member, to get vaccinated as well, because the more people that get vaccinated, the safer we all become on that. I want to talk a little bit also with regards to individuals who are between the ages of 12 and 17. Currently, there is one vaccine available for individuals aged 12 to 17. That's the Pfizer vaccine, although we do expect that to change in the coming weeks. Moderna formally applied to the FDA to extend their emergency use authorization to younger individuals down to 12 years. They applied last week, and we expect the FDA to return a decision really within a month or two on that. That'll give another option for younger individuals. For young adolescents who are interested in a more normal summer, interested in a more normal fall school semester, getting vaccinated right now, choosing to be vaccinated, is the easiest, best way to do that. I want to end by letting folks know that tonight we have a really nice webinar on this specific issue on vaccines in children aged 12 through 17. It's being hosted jointly by the Department of Health and the Department of Education. We have a number of leading pediatricians who will be on there. I'll be on there myself as well. It's at 5 p.m. Anyone is welcome to join. Adolescents, kids, their family members, teachers, educators, 5 p.m. tonight, and the registration link is on the Department of Health website. So if you go to ldh.la.gov, you can find a link. Anyone can register. A lot of good information will be given there. There still are a lot of myths about these vaccines, but look, there's been over 300 million doses of these vaccines given nationwide. That's an unprecedented rollout of a therapeutic or a vaccine, and these have proven to be not only highly effective, but very, very safe medicines, and the CDC and the Department of Health recommend anyone 12 years of age and older to choose to get vaccinated. I'll pause there. I'd be happy to answer one or two questions if there are any. Yes, ma'am.
So is the Delta variant now the primary variant that we're seeing in Louisiana, or is it still the other one that was originally called the UK variant?
It's not. It's still what was formerly called the UK variant. Now it's called the Alpha variant, or B.1.1.7. That's still the most prevalent variant here. But the concern is that this Delta is growing faster than that UK one was at that point in time. So, again, nationally it's about 10%. Regionally it's 12.7%. We don't have an exact percentage in Louisiana, but presumably it's close to our regional average. Okay. Thank you.
Good afternoon. For months, you've heard a clear message from these two leaders from this podium about the vaccination against COVID-19 and talking about it being our best path to bring back Louisiana. Today, the lagniappe for taking that shot is more than just a little something extra. Cash for college is always a reason to celebrate, and Governor, I thank you for including college scholarships in this Shot at a Million program. Scholarships, as you know, can change lives, can increase opportunity, can open doors for our students. This arm of the program is created for our future students in Louisiana, those 12 to 17-year-olds who've had at least one dose of the COVID-19 vaccine. We encourage those students to register, or for their parents to register them starting on Monday, so that we prioritize both health and educational opportunities through this part of the Shot at a Million program. 9 lucky students will each win a $100,000 scholarship, which will be deposited for them into the Louisiana Start Savings account. These scholarships will help our future students advance their education at a 2-year or 4-year institution, or through an apprenticeship program, and I can tell you for sure Louisiana institutions will be delighted to welcome them with open arms when they are ready to enter our colleges and universities. We know it's never too early to prepare for education for yourself and your children, and this Shot at a Million may just help you pay for it. Now, for those of you already in college, and I know we have a room full of Governor's Fellows, so we have college students here today, you too are eligible to win cash prizes through this program. And you can, of course, if you're a winner, use some of that cash to pay for your tuition too. So we want you to take your shot as well. Getting vaccinated will help get campuses bustling and get us back to more in-person activities, back to hugging friends to say hello, back to social gatherings like tailgating and big dinners, back to in-person classroom conversations with faculty, back to labs, back to research, back to experiments, and yes, back to in-person study groups and sometimes those cramming sessions for classes as well. I know we are all excited to get back to these on-campus activities, and we encourage you to get your shots so that we can go back safely. Getting vaccinated gets us back to the things we love and the things that we have missed here in Louisiana. So today our message is clear: to bring back Louisiana, go get your vaccine and go get registered to win the scholarships or cash prizes. And Governor, thank you again for this support. We're very excited for this program and very grateful. Thank you.
Thank you, Dr. Kimona-Reed, and thank you, Dr. Cantor, as well. I appreciate your attendance here today and all that you do for Louisiana. Before I take questions, I do want to just remind everyone that we have potential for severe weather this weekend, and we can't tell you how bad, exactly where, but we will know a lot more over the next day or so, we believe, from the National Weather Service. The Hurricane Center is investigating the storm now. The forecast should be refined and improved, but South Louisiana along the coast, anywhere from 1 to 8 inches is possible, and it could be higher in localized areas. And we already have ground that's saturated and drainage ditches and rivers and streams and so forth that are full. And so rainfall now would actually have a bigger impact than you would expect just from what we would receive over the weekend. You can get information at getagameplan.org, so please do visit getagameplan.org to make a plan, but also visit shotatamillion.com. And you can register to win cash and scholarships, and again, you can start that on Monday. Go to shotatamillion.com. As a reminder, you have until July the 9th to register for the first drawing, so that is plenty of time for everyone who hasn't yet done so to begin their vaccination process and then register. So with that, we will take some questions. Yes, sir.
Do you guys have an estimated time frame for when the storm system would make landfall?
No, right now we just know it's projected sometime over the weekend, but it depends on how fast it moves north, and that's really what they're trying to figure out now as they investigate. What is that, the center of the storm? Has it started circulating and moving and so forth? But we would encourage you to pay attention to the Weather Service, to local forecasts on the news, and then also pay attention to local officials as well. Yes, ma'am.
Based on the experiences y'all have seen in other states, who tends to be most attracted to these kinds of initiatives? Is it folks who are younger, or does it cross all age groups and ranges?
It really does cross all age groups, and particular interest is among the younger folks, and obviously that's why we're including a number of drawings for the $100,000 scholarships, because that's what we can do for that particular group of individuals. But it does seem to run across the spectrum, and of course what you're trying to do is get people vaccinated who haven't yet been vaccinated. So as I speak to you today, almost 80% of Louisianans 65 and older have been vaccinated with at least the one shot. For those who are over 18 and over, it's almost 50%. And so you would expect that if you're going to get more people to be vaccinated, which we certainly hope is a result of this campaign, that you're going to see that more in the younger, because those the larger groups of people who remain unvaccinated. But it will extend across the spectrum. Yes, sir.
What pot of money is this coming from?
This is $2.3 million coming from the CARES Act, and specifically it was approved for this purpose. It's outreach and education money, that's available through the federal government. Yes.
How much of an increase in vaccinations are you anticipating to see after this announcement? And are you at all worried about those who may have been on the fence over the past couple of months about getting a vaccine will see this as a kind of bribery?
No, we don't worry about seeing it as bribery. Ultimately, it's a choice. They're going to have to choose for themselves. We've, not just we, but the federal government and many people in the medical community have been talking about the benefits of being vaccinated throughout. All of that stands, and that's why we're saying you're a winner if you get vaccinated, whether or not you enter, and if you enter, whether or not you win. But we know we have some individuals who repeatedly tell us, and it's a fairly substantial number of folks in the aggregate, that they are wanting to be vaccinated. They're just trying to figure out when they're going to do it. Well, the sooner the better, because we still have, every day, we're reporting people who've died. We're reporting somewhere in the 280, 290 range of people who remain in the hospital and so forth. We know this Delta variant is growing in prevalence right now, and so forth. And so trying to give someone incentive to make that decision, but make it sooner, I think is very helpful. And it's a very modest, very small investment overall. And just to put this in perspective, just from the American Rescue Plan, which was made available in the most recent act of Congress to help states with issues related to the pandemic, $3.1 billion. This is $2.3 million. And so it's a wise use of funds to try to increase the rate. We don't have an exact percentage of what we expect to see, but we know we expect to see an increase. And one of the reasons that we waited is because we wanted to make sure that this would be a good use of these funds. And so we wanted to see what the experience was in other states that actually pursued something like this in order to promote vaccinations. Yes, ma'am?
For replacing the head of the gaming commission, and also if you would want to comment on the former commissioner resigning and electing not to appear before the Senate committee for his appointment hearing.
Well, I don't have a date certain by which I intend to name the next chairman, but it's going to be relatively soon. It just happened last Thursday, as you know, and so we haven't had an awful lot of time to figure that out, but we're going to do that over the coming days, and so we expect to have an announcement for you. You know, I just want to thank Mike Noel for his service, and he did a good job at the state police for a career, a great job, and much of that time he spent in the gaming division at the Louisiana State Police, and so that's why he brought a wealth of experience and knowledge to the Gaming Control Board. Ultimately, he withdrew from consideration for remaining there through the nomination and confirmation process. And so we're looking for someone new, and I expect to be able to make an announcement relatively soon on that. Yes, sir.
Hey, Governor. So how much money from that pool that you said that Louisiana got for outreach and things like that for vaccines is left after this program?
Well, I would have to get back with you on that. I can tell you that the amount of funding that we have gotten through the CARES Act, which is where this money came from, was before, and remember there was basically CARES 1 and CARES 2 and now the American Rescue Plan. What I can tell you is this is a very small amount of the funding that has been made available. And another reason this is important is just the Herculean effort that continues across the state of Louisiana every single day. I mean, the costs associated with having a vaccination program that you're administering through 1,500 enrolled providers. We have over 900 National Guardsmen on duty every single day doing testing and doing vaccinations and doing hotshot missions and running things back and forth and many other things related to the pandemic. And then you look at all the costs associated directly with state agencies and the costs incurred because people are being hospitalized and so forth. This is an extremely modest, but we believe it will be a meaningful incentive in order to get people to be vaccinated. And that's where I want to close out today, is we're here in an atmosphere of celebration. We can celebrate because we're doing better. But we can also celebrate the fact that we have 3 safe and effective vaccines. That is the ticket out of the pandemic. But having the vaccines is not enough. We've got to have the arms to match up. And quite frankly, that process is slow to the point that it is concerning. But we understand that this is a decision that has to be made by individuals. They're going to make a choice. We want them to make the choice to be vaccinated. We want them to be comfortable with that choice, and we're trying to marry them up with the healthcare professionals who can answer their questions and so forth. And we also want to make sure that people will make that decision as soon as possible, because every day makes a difference. There are people who are getting sick, going to the hospital and dying because they've waited about being vaccinated. They never decided they weren't going to be vaccinated. They just, for some reason, they put it off, and they were waiting for something to happen or for whatever it was. And they're getting sick, and some of them are dying right now. So this is an opportunity to really move forward. We hope people will take advantage of it. I believe that they will. And I want to thank everybody in Louisiana who has worked so hard. You know, we started off for the first number of weeks #1 in the country in per capita cases. We're now number 31. And what that tells you is we've managed the disease together, because everybody's had a role to play, and we've said that from the beginning relatively well. And it's been a very painful process, and it's been very expensive, and it's been debilitating to a lot of people's livelihoods and lives. That's the nature of a pandemic. But this is our ticket out of it, is to be vaccinated. So I am celebrating. I hope you all will celebrate. I want to thank the Mahogany Brass Band again for helping us to celebrate in fine fashion today. And let's make sure that we lift one another up in prayer, that we're good neighbors, and that we understand that not only is it time to register for a shot at 1 million, that it's also time to make sure that we're ready for hurricane season and all that can bring to our state. So thank you all very much, and God bless. And thank you again.